This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep.
Although people who are very old and in poor health sometimes welcome death, most of us have difficulty facing death regardless of our age and health. How we deal with death depends on whether we are medical personnel treating the ill patient, relatives or friend of the patient, or the patient himself or herself. Each may have a different perspective on death and dying. Physicians and other healthcare professionals often use the term dying trajectory to describe how a very ill person is expected to die. Death from a terminal illness such as cancer, medical personnel do everything possible to treat the patient, but ultimately custodial care predominates. In contrast, when a patient goes into cardiac arrest or a severe accident, staff typically work feverishly to preserve the patient's life and well-being, sometimes successfully. When an elderly person suffers from a terminal illness such as advanced cancer, healthcare professionals expect the patient to have a lingering death. Overworked hospital staff especially may respond to the patient's request more slowly, place the patient in more remote wards, or even bathe and feed him less frequently. Family members, in contrast, typically expect their elderly relatives to be treated as painstakingly as any other patient. A patient's perceived social worth can also influence the care that he or she receives. For example, elderly patients in private hospitals or those with high socioeconomic status often receive better care than do poor elderly patients or those in public hospitals. Derived from the medieval term for a place of shelter and rest for the weary or sick travelers, a hospice is a place for the care of dying patients. Because death seems imminent, a hospice provides pain control, gives patients a sense of security and companionship, and tries to make them as comfortable as possible. Hospice care is available in a variety of settings: patients' homes, hospitals, nursing homes, and other forms of inpatient facilities. In the hospice approach, physicians, nurses, social workers, and clergy work as a team to meet the physical, psychosocial, and spiritual needs of the patient and his or her family. Also, to give the dying people full and accurate information about their condition. Hospice staff members work with family members and friends to help them deal with their feelings and sorrow.